Morning, guys. Sunday morning coffee. Let me get my lips ready for a Sunday morning Aerify. Morning, guys. Hey, guys. I'm gonna put a little on here. This is my Lucy & Co. Lip Magic. Morning, Roger. Sorry, this is my Restore C Lip Magic and my Lucy & Co. Lip Plumper. Hi, Sean. Morning. We are having a great Aerify today, all the way from Egypt, you guys. We're going to be talking about EMERAGESKIN Aerify. Dr. REEM is on, one of the most famous aesthetic physicians in famous physicians in Egypt. She will be on in a second. I'm getting my lips prepared with my Lucy & Co. Lip Plumper. You can get all this at emeragecosmetics.com. Can't wait for you guys to all join. It's going to be great. And we are going to go live all the way from Egypt today to talk about Aerify. That's how far this is going. Japan, Middle East, Egypt, everywhere. We have so many. I see Dr. REEM has asked to come on. I'm just going to talk about two things and we're going to bring her on really quick. I keep getting questions about Cispera. This is one of our favorite products right now, an intensive pigment corrector for every skin type, specifically for those with very dark skin. You put this on for 15 minutes and you wash it off. Really easy to do first thing in the morning, and it brightens the skin tone. It is unbelievable. If you don't want to use bleaching cream, you can use Cispera. The other thing I keep getting asked about is our nude skin citrus glycolic toner. I do use this everywhere: face, neck, chest, arms, hands, buttock. If you have acne, you could use this. This is a water-based toner, 5% mixed acids, grapefruit, lime, lemon, orange. It has other alpha hydroxy acids in here. Use this every day as your toner after you've cleansed and exfoliated. And then lastly, I keep getting asked about the 10X. This is an enzyme from salmon roe. This does lighten the skin and acts as a retinol alternative. So for those that don't have good results with retinol, or you don't want to use retinol every day, add in your 10X. I love this on your chest and neck, on your hands. I add this on in my face with my peptide serums like my Refit Face and my Refit Eye. So let's bring on Dr. REEM, because normally I talk a little bit. Hey, Aries. Hey, guys in Pakistan. I would, LA Basics is on, guys. There she is.
Hi,
Hello.
how
So
are you?
introduce yourself to everybody.
Hi, this is Dr. NOUMAN. I'm a dermatologist based in Cairo, Egypt, and I've been in the business since 10 years, and I'm a very big fan of Dr. Jason since forever.
Thank you. What do you like about what we do?
Actually, everything, starting from the procedure you do to the skin and going all through everything you do. But from the beginning, many, many years ago, when you started to do the combos for the skin, when you mix the microneedling with the lasers and you doing TCA same session, it was something that it was not so common. And what was really nice about you is that every time I used to ask you about details, you used to answer me about what concentration did you use, what to start with first. It was amazing. And another thing that I loved about you, and I've always wanted to follow this school with my patients, is that the transparency. You've always been so transparent with your patients. You just put everything on the videos, every single detail, how harsh the videos is or how entertaining the videos is. They just feel that they are step by step, minute by minute with you in the clinic. And that's very nice, because our patients like to be educated. And then, as much as we will say, it's not going to be the same as we show them live what's going on. So that's the school I love about your account, and I love about you, and all your team is
Well,
amazing.
I've always been the person that's very honest, tries to be very trustworthy. And you want, in our industry, you know how many people really want lifelong relationships. You know, they come to you, they trust you with their skin, but then maybe they ask you about other questions, or they always want to be coming back to you because they're going to be trusting you with taking care of them forever. You're always trying to get rid of sun damage. You're always trying to keep people looking better, feeling better about themselves. And especially if they have scars or pigmentation, it's a process to get it improved. And sometimes you can't get it fully improved, and you need to be honest about it with people. You know what I mean? And sometimes that's, you know, that's the difficulty. It's also harder where you are because everyone has darker skin tones. And they're
Yes.
always, I mean, I'm always in the sun, but so are you. And so there's a lot more restriction there for laser treatment, certain combinations. And if somebody has very severe scars, it may be really difficult. I just want you to
Yes.
know people are here from Cairo, Naples, Florida, Singapore. They're here from Pakistan. They're
Hi,
here from
everyone.
Taiwan, LA,
Wow.
Arizona. They are calling with they're saying, Jesse, you're waking up with swollen eyelids. I know it's Sunday morning. You got to start with your good skincare. They're calling from Italy, and there's just everyone from everywhere. So I'm really excited that in London, oh my God, we guys everywhere. So just so you guys know, they're asking a question: laser recovery for upper bleph, anything related to surgery or dermatology. Consult it with us, emeragecosmetics.com, or send us a DM. I want to talk today about skincare because I want to know how important in your practice is our skincare products.
Well, skincare products in general contribute to a very big part of the treatment. We always tell the patients that how many sessions we do in the clinic, you have to maintain with a good regimen at home, or it's going to be the same. So keeping a good regimen is very good. Finding one is even harder. So that's what I like about your products. It's very well studied. I've seen the results of the sessions you've done before and afters on every aspect, even the Botox and fillers. I love your results, by the way, and everything, and the surgeries and everything. But I'm talking specifically today, we're talking about dermatology. It's very important for everyone to know that we always tell you that there's like around 50% of the results. We will help you to achieve the optimum result, but you have to maintain what you have achieved by a proper skin regimen. And this, when it comes from the one who invented it, is almost the same one who treated you from the main problem. For sure, he knows what ingredients to put in the product. That's what I liked about. I've been following the product since a while ago, and I've seen the reviews. I've listened to people saying that it's not a harsh treatment. That's something we have to consider a lot in our country for so many reasons. Now, maybe many of you would not think that this is the way in Egypt, but the whole field is becoming very obsessive. Everyone is so obsessed about Botox, fillers, skin, and everything. So when you come today to tell a lady or a man that you're gonna do a peeling at home, that's gonna be really aggressive, and you're gonna be for like 2 months peeling off, and you're gonna go to your work with some flakes on your skin, they are not so excited about it. So when you find something that's gonna give you an optimum result without going through such a hassle, it's something very interesting to be considered.
I agree. Thank you, Remy. Thank you guys for following. There are more from Cairo, Atlanta, New Jersey. Love all you guys. When I created this product line, this was not to be originally anything big. It was supposed to be for my patients in the office to enhance their results. Whether they did laser, we would place this on at the same time so they would heal faster. Whether they went home and wanted to use a simple regimen to maintain their results and add into other treatments that they have, like I recommended this morning, Cispera and my glycolic toner, which I also help create a different product line. Restore C, all of these I know exist. I know people are going to use them. And I wanted to give them something that would boost those results that they would get at home with the things they were already doing or the other products that they love. Because bottom line, you're not going to use just one product line. You never will. That's also why I made my derma rolling kit at home with stem cells, which are our Aerify anti-age stem cells. So I don't know, in Egypt, do they have anti-age?
Yeah, no,
Yeah,
but we have a lot of products, stem cells in general. We love to use them. They
exactly.
have very, very nice results.
And that's the thing is, so I knew everyone wanted these, and I know that when you spend a lot of money on lasers and peels, you really need to maintain that. It's like going to the gym. You need to go consistently. You need cell turnover, that collagen production. You're being where you are getting exposed to sun all the time, so we got to reverse it. So having that at-home treatment that my patients could do between the every 2 or 3 months that they come to see me for the lasers or the Botox or the filler. That's why we did all this. So this is all designed as a dermatologist daily regimen, like a regimen that we recommend, a real one. And the products inside were made to give you a result in 2 weeks, because most product lines, if it's not medical grade, you're not going to see much. It's just going to be, I call it the street cleaner, a little bit of a polish. You know, it's not gonna really reverse things. With this Aerify, you can actually reverse, and it's really amazing. And Sean's asking Cosmelan or Rev Peel. Just so you guys know, I helped design Rev Peel and get it made. That you cannot decide between those two. You need to get a consult to decide. Those are medical grade peels by dermatologists. Those also have hydroquinone, which in some countries is not allowed. In Egypt, are we allowed to have hydroquinone?
Yes, it's fine.
I just like people to know. And I actually made my Aerify without it, because we are going to have an ingredient kit that has it, but other countries you can't have it. So I wanted to be able to get this to be as a maintenance to a peel like a Cosmelan or an Enlighten. I actually do now the Aerify mask, which is inside. I'll show you guys the illuminating mask. I use this right now as a weekly micro peel. So instead of taking this entire amount and putting it on my whole face, which is what I'm going to tell you to do anyways right now, because that's how we designed it, I'm using about a quarter or about half first time, and then every week I do a little bit more once a week. I find that as a weekly micro peel, it's a really good maintenance. Some of my patients buy 4 or 5 of these at a time. What they'll do is the weekly micro peel, then once a month a bigger treatment, and if they get a laser, we apply it right initially. So yesterday we did probably 5 or 6 laser treatments where we applied the Aerify mask immediately on right afterwards, because it allows the penetration of the mask to go in more. You could do it with microneedling. There's a newer procedure which we will be highlighting starting about next week called Mirror Peel, that uses micro rolling and infusion at the same time. So it's needles with infusion. And we're going to do the needle infusion, or we call it transdermabrasion, and then we will apply the Aerify. And the results are like striking amazing with minimal downtime, which is what we need with your darker skin tone, olive tones, people that skin is reactive and gets hyperpigmentation or acne bumps. So that's why I actually made this, was more for my own patients. And then everyone started wanting it, especially the Aerify kit. We actually sold out of my HYLA-B, even though we made like thousands. So we just redid it. That's our hyaluronic acid, you guys. It's actually, I thought was going to be one of the least that everyone wanted, because it's kind of very competitive with a lot of companies out there. But for the pricing and the results of it, mixed hyaluronic acids and molecular weights, it's really good skin plumper. And a lot of women like it because it's very soft. It's very smooth. And actually the HYLA-B, the hyaluronic acid, is inside my HYLA-A, which is the retinol that's inside the kit. This is a very light retinol with hyaluronic acid and licorice root. And I don't know if you guys know a lot about licorice root as an ingredient. This is a nighttime product that you use with, now some people will add, like for example, a Restore C10X, which acts as a retinol, or even a stronger retinol with this to get a bigger result if you wanted. But this is good for starting if you have acne, and the licorice root decreases redness. So people that have rosacea, acne, or even pigmentation, this will improve it, because pigmentation is inflammation.
Yes, we have a lot of peels also in Egypt that has licorice. It's becoming one of the important ingredients.
And remember, I did this about 3 years ago. So this is way before everyone started knowing that these ingredients like bucuchiol and a tranexamic acid and all these other
exactly. Now all the peels in our country are being replaced with the new peels that has tranexamic acid instead of hydroquinone. So yes, that's very true.
We were developing those before. I'm actually making right now, or I've been making, a at-home weekly peel, a paint-on peel, that's a tranexamic acid peel. And it's really pretty amazing. Light retinol, tranexamic acid, vitamin C for every skin type. So we're really, you know, you and I are at the like cutting edge of it because we're always seeing clients, we're always trying to develop new things, and we're studying and we're following people to see what's new and out there. A lot of people, they get stuck in doing their normal things for a very long
Yes.
time. And what do you think? The
Yes,
industry
very
is
true.
changing so much. You need to change with it, right?
Exactly. And you have to be creative. You have to be, you need you to think outside the box. How can you always keep your patients getting better and better result every minute? And this is not gonna happen until you think outside the box and to avoid your patients reaching a plateau. So sometimes I feel this with my patients. I said every time she's doing the same, so she or he is gonna always feel that they have reached the peak where they want more. So this is when I started thinking, oh, maybe now today I can mix skin boosters with microneedling. That's what I try to think about all the time, you know. That's why I loved your school, because I feel you always do the same. You try to think outside the box and to mix things together and to do synergistic actions that gives the patients the best result from a single
Exactly.
procedure.
You know, and just so you guys know, we will be applying the Aerify. Don't worry, we will get it on. I know you're asking, and if you guys are asking about doing Aerify, DM us. We'll get you information of whether or not we can. They're also asking about threads for the nose. That's one of the things I tell people not to do. I don't like it. I know people do it in other places. I don't like it
Really,
because
you don't like threads in the nose? I
I
love
don't, because
doing
I'll
them.
tell you, I have seen, you know, I am the doctor that tends to fix everybody's mistakes, okay? And I'm not
Okay.
saying there's a mistake, it could be a complication. But I've seen
Mm-hmm.
many times threads extrude through the nose. I've seen actually necrosis twice from it.
Mm-hmm.
But if you know how to do something, you could do it. I do filler very well there. We do certain, I'm one of those people, I don't choose not to do it unless it's supporting the septum only. I don't like it as much to pull up, but I have seen complications. So I just say
Okay.
it's not my thing to do, but go to an expert to do it. And then you guys, any questions you have on skincare, just so you know, you can ask us here, but we do virtual consultations. It's the one thing we do at EMERAGESCosmetics.com. About every day, we do between 5 and 10 virtual consultations with my estheticians and skincare specialists. We have 4 of them, and all day, all they're doing is peels, facials, virtual consultations, and skincare sales. And that is because it's so important to everyone to have a regimen. And my patients specifically, they want to maintain their results when they come to the office. And those that can't come to the office, then they're getting that type of regimen that we do in our office at home. And so, you know, I have patients all the time. A guy yesterday we consulted who's doing CO2 next week at a different dermatologist who didn't give any skincare regimen. So, but
Mm-hmm.
he's in another state. So we sent him our
Yes.
regimen and we told him what
Mm-hmm.
to do. So do you want to apply the mask?
Yes, sure. I
So
can't
the
wait.
yeah, let's do it. So open the Aerify Illuminating Mask. This is a orange yellow color, you guys, because it's retinol. You can change the color, but I want to tell you something. If somebody changed the color, it's just for marketing purposes. A retinol-based peel is always going to be this color. And this has in it TCA, lactic acid, salicylic acid, and retinol. Very low quantities so that it won't damage or burn the skin. And yeah, tell them how a dermatologist always applies like that. I do
Uh,
that. A pea-sized amount in every little place, and then you
yes.
rub it in,
Yes.
and you
And then if I
layer,
want to add another layer, yes,
and
exactly.
then you layer. Yeah, that's the dermatologist way. So you know that she's good, you guys. You guys know she's good.
Thank
And here's
you.
the thing. This is not going to be a burning peel. This is going to be an exfoliation peel. There's different types of peels, such as inflammatory peels, where you leave them on, and then everything peels off like a snake. These are
Mm-hmm.
exfoliation peels where the skin gets told to turn over faster, so you get very light speckling and peeling over the course of a week or two. Cosmelan's the highest strength of that, Enlighten right below it, and then Aerify, which is your at-home version for maintenance. So I think, especially in Egypt, for example, if we don't have this, we could get that there, and people could maintain with this between
Yes,
their
please.
facials. Yeah, we will. We can get it to you if you want. No
I
problem.
already have a lot of patients that saw the stories and
Sure,
they
let's
told
do
me
it. Yeah,
already
we can.
want,
I
so we
will hook
really
you
want to
up.
work on this.
I will hook you up with our CEO. We'll figure out a way to send them. We just sent 250 to a couple of doctors in the Middle East. So
Okay,
they're going to
great.
have them go in there. Thank you so much. Trilla says we are beautiful. I love that. And I just want you to
Thank
use
you.
that whole amount. So don't be shy. Get it all out. And when you
So
think,
another important question, you were saying in one of your videos that we can apply it under the eyes as well, right?
yeah, so I actually do, you can do it as a at-home eye peel once a week.
That's
So I have
very
some
nice
clients,
because a lot of products are not allowed in this area, and
well,
we have
here's
a
the
lot
thing.
of patients complaining from this.
Well, here's the thing. It has in it TCA and in it retinol. So if it gets in the eye, it's going to be irritating, but it won't hurt you. It also
Okay.
has Arbutin and Niacinamide, you guys, both anti-inflammatory ingredients. One's a vitamin, the other's just a natural ingredient that helps decrease inflammation and redness. And then a high dose of vitamin C, 20% vitamin C that's in there. So these ingredients are great for at home. I have a lot of patients that do what's called DSC. It's a type of retinol application in the office, a type of peel we do around the eye. That's why I made this. DM us, you guys, your name, email, and phone, and we'll get you a consult if you need anytime. And if you want any of these products, it's pinned right below. I know, keep asking, emeragecosmetics.com. It's on there.
And we can apply on the neck as well, right?
Yeah, but here's the thing. The amount is really set for one area. So
Okay.
if you want, do 3/4 of it, then a little here. But for real, if you're really going to treat multiple areas, you guys, you need to get 2 kits. The new masks will actually, we're going to have sets of masks that will be available at end of the year near holiday that you can add on masks and use them for just the mask and not have to get the kit. So yeah, we're just gonna apply, and then I will tell you guys there's an instruction card inside. It's right here. And then also the High Spot, which is our tried and true kit main product. This has it in botanicals, peptides like my EMERAGESKIN Refit Face and Eye, and it has in it vitamin C, again, more vitamin C, and other brightening botanicals. It has in it green tea for puffiness around the eyes. It's a really amazing product. And then the 2 other products in there that I love, this is our #1 selling product, foaming polish. This is a really amazing water-based foaming cleanser that has jojoba, which makes it act like an oil-based cleanser, so it's very hydrating. More
Yes.
licorice root in here for
Yes,
brightening.
I felt this. I
What did
felt
you
this when
think
I
about
used
it?
it. I loved it because I have a combined skin. So sometimes when I used to use cleansers for oily skin, it was a little bit harsh on my skin. And after
Yeah.
washing it, I used to feel it's very tight. And sometimes even the stronger the cleanser, the more probability of a breakout I have because it's too strong. It's shedding
Yeah.
my skin of its oil. So this is something I usually highlight to my patient is that if you have combined skin, don't go for harsh cleansers because it might exaggerate the problem. So what I
And
love about this cleanser, I used it yesterday and today, is that my skin is so soft after, yet I feel it's very well cleansed. So that's a very nice combination. I really loved it.
thank you. And that's, I'll tell you right now, most of my clients, they buy this kit for this little baby one, and then they refill with the full size. So they have a
Yeah,
little travel size. So just so you know, she just said something really important. If you have oily skin or prone breakout skin, you don't want to use harsh cleansers such as witch hazel or alcohol, or even salicylic acid sometimes can irritate you, or
yes,
glycolic. You want to use them in very low quantities, because if you remove the oil, it actually causes you to produce more oil. And so
yes, I
that's
know.
why I made the Nude Skin water-based citrus acid toner. This is 3% glycolic and 2% mixed acid. This is actually all over the world. You can get it at Sephora, Ulta, Emerage Cosmetics. It's very inexpensive, but this is a really good toner. So if you feel like you are a little oily, but you want something that's going to control, use the foaming polish, because it has a jojoba, which acts as an oil cleanser to make it more soft on your skin, and then use the 3% glycolic, 2% fruit acid toner. And that's something really important to know. The other thing that's really important is you also, when you're using sunscreens, you don't want sunscreens that have too much of the drying effect in it as well either, because that also can cause you to worsen, which is why we made our Fusion Shield, which is inside the kit. a little bit of a tint, so it's a cover up. It's like a BB cream, but it also has in it the vitamin C, and it doesn't have alcohol. So you will have this application is again a more oil water based applicator, which allows makeup to go on more easily on top of it, but also will not cause a breakout, which is why I love it.
Amazing.
And I don't know if you got to try it yet, but it has a little bit, it's actually really good for your skin tone. I
Yeah.
mean, a little bit of a tint, and when you rub it, I'll show you right here, it literally blends right in. I mean, so easy, even with a large amount. So
Yes.
my patients that are going from other bigger companies switching over to Fusion Shield, they love it because it's really easy to camouflage like little breakouts like I have right
Yeah.
here.
Very interesting.
So how does it feel?
It's very nice. So far, it's very easy to be applied, and it's very nice. I can't wait to
Yeah,
see
it
the
should be
result.
cooling. You leave it on for 8 to 10 hours. Again, there's different ways to do it. Dr. Nizmaleman is asking a question. Do we need to apply a whole mask? Yeah, so when we originally tested this, this was the full amount you needed to see that actual result at 2 weeks. So you would apply this in whole thing, one area. You would get another one if you want to do another area. And then you would use the kit for 2 weeks. Now, we've been testing in different ways, doing derma rolling at home and applying only half of it. You do the derma rolling once a week and apply it half as a weekly micro peel, or you just do a very small amount every other day as a retinol, because it's basically a stronger retinol because it's TCA, lactic acid, salicylic acid retinol. So you could use it in various ways. Like I said, if you get this to your clients, you could do it right after a facial, right after a microneedling,
Lasers,
right after a laser.
microneedling.
Yeah, I mean, and then this one of our patients says he's gay, but you're so effing beautiful to you. That's
To
what he
me,
said.
oh, thank
He just
you.
wrote that. I thought he was
Thank
talking
you.
about it to me, but he's not. He's saying you.
Okay.
So
Thank
obviously,
you.
why do you think, Jess, I brought her on? Because she takes good care of her skin, and I want somebody who knows skincare to really be using the kit. Originally, I don't want to tell you guys, I tested Aerify on over 1,000 people. We only had one reaction ever. And
That's amazing.
rarely do we ever see a reaction. I mean, retinol could always cause a reaction when you first start. So that's the last thing I want to ask you about. When people start a skincare regimen, what do you tell them? Because obviously people go, oh, if they break out, they want to stop. Or let's say they get a little irritated from a product, they want to stop. What do you tell them?
Well, it depends on the regimen I'm putting it. It's for pigmentation or acne or pores or whatever. But usually when introducing high percent of retinols, sometimes I introduce them to the idea of the retinol uglies. We know that we have retinol uglies. That's the ugly phase where you might break out a little bit at the beginning of the treatment, but it goes away after a while. Sometimes they can suffer from some irritation, sometimes from redness, sometimes flaky skin, but we managed to combine this to make them understand at the beginning, and then to manage it with the proper moisturizer, or we introduce a hyaluronic acid serum to hydrate, and then we introduce with it an acne prone moisturizer, and so on. But the thing I want to tell the patients and the followers now is that I'm applying the mask now, and I'm not even feeling a tingling sensation. I've tried some other products, and the first thing that used to annoy me at the beginning is that I used to feel strong tingling sensation or burning sensation that made me uncomfortable at the beginning. Now I'm not feeling it. So it's something that ensures that it's not harsh, and that it's at the same time it helps you to be more compliant with the treatment, I think.
Exactly, and that's why I think so. Just so you guys know, the first of next year, we're going to have a series of kits. There's an anti-aging one, an acne one. There's all different ones that we're going to have used for certain things, and I'm going to even have one that's going to be designed as specifically for a laser or a procedure. And long story short is, it's made for every skin type as a maintenance. It's not supposed to be harsh. If you want something stronger, you need to go to a dermatologist. You don't want to order something on Amazon and try and burn your face like
Yes,
TCA. I
please,
had
please,
so
because
many
we've seen
clients
the
do that.
dusters. Yes.
I had patients this past week with scratches all over her face because She got a roller off of there that got infected. It was a dirty roller. You don't want to do that. You need stuff that's for stronger, that's curated by your dermatologist, whether that's a skincare regimen, a peel regimen. We do at-home virtual applications of peels through our website, but we're monitoring you, we're teaching you. It's totally different. So someone just said, Rosh said, Dr. Reem, I have sensitive skin. I'm ready to try it on me. Go to Dr. Reem, you guys. She's great. You're going to love her. All right, well, that was great. So I think what we should do, and this is what I was telling my team, in a couple of weeks or maybe a month or so, we do another one where we do the roller and maybe get you a couple other of my favorite products or my nude skin line. I don't know if you've seen it. I
Yeah, I
posted
can't
about it.
wait. I use the makeup all the time. I
Oh,
love
you do?
the
Oh, good.
products. It's amazing.
Well, we'll send you the kit for the product lines that has in it. I really love my
I
favorite
can't
products are
wait.
the glycolic toner and the lemonade detox micro peel. It's a vegan cellulose lemon oil peel, but
Wow.
we just came out with a product. It's not out yet that you'll love called the Tight and Bright Mask. It's a
Nice,
niacinamide and mandelic acid mask that you could use daily. It's really
nice.
amazing. So there's a lot going on.
Actually, there's a lot of people asking for niacinamide in general. Now the information or people or patients are becoming very well educated. So they come to the clinic and tell me, hey doctor, we need a product with niacinamide. So thinking about a mask with niacinamide is something that
Yeah,
I
that will
think
be,
many will be
you will
interested.
love it, and it will enhance what you're doing already with all your other products, especially if they have redness and they want a little bit of an improvement without much sensitivity. In my
Mm.
product kit, everything almost has niacinamide. There's niacinamide in the high spot. There's niacinamide in the Aerify illuminating mask. There's niacinamide in I think in the sunscreen as well. So it's very, very particular to that because that is a vitamin that decreases inflammation. So it makes it better for every skin type. So, all right, well, you guys need to follow Dr. Reem. She is going to keep us up to date and let us know if this really works, you guys. Does Aerify
Sure.
work? I'm telling you it does. And then
Yes,
that's
I'm
it.
sure
And
it
then we'll
does.
get her back on because this was a pleasure. And just so you guys know, we're many hours apart, so we planned this properly so that we could get
Yeah.
all sides of the world on this
Yes.
live today. I'm
Yeah.
sure it's going to make a huge statement to everyone, which I love. And I really would love to get you some of these products, and we can get them to you. Just email me directly, and
Okay, sure.
I'll get you in touch with Jerry.
I can't wait, and I'm sure I'm gonna love it, no doubt.
I
And I'm
know it
gonna
for
keep you
sure.
posted with the pictures and everything so people can see every step of the way how it's gonna look, because I think it's gonna be promising.
And they love it. The Jess is saying he loves it. The Naples esthetician is saying they love it. Rosh is saying they love it. Brian, it just goes on and on. And
Yeah, I've seen the reviews. The reviews are amazing.
Richika, if you have questions about hyperpigmentation, contact either one of us. That's our expertise. All right, you guys, have a great weekend. Thanks again for joining Aerify. This was wonderful.
Thank you so
Bye.
much for your
You're
time.
welcome.
It's a pleasure, and I can't wait for more videos between the two of us.
I agree. Loved having you.
Me too. Thank you so much. See
Bye.
you. Bye.